The healthcare industry in the United States is undergoing massive upheaval. In the name of maximizing profits, hospitals, health systems, and even medical technology companies have laid off tens of thousands of workers over the past year. This layoff pattern threatens to push an already understaffed healthcare system to a breaking point, and it is happening at a time when patient demand remains high. According to an analysis by consulting firm Challenger, Gray & Christmas, the healthcare sector cut about 58,000 jobs in 2023, which is a 91% increase over the previous year. Healthcare layoffs trailed only the hard-hit tech and retail industries. Furthermore, consulting firm McKinsey estimates that ongoing COVID-19 infections could add between $137 billion and $379 billion in additional annual healthcare costs due to the long-term complications and disability that comes out of these infections. Now, despite these estimates, healthcare companies large and small across the US have proceeded with ruthless job cuts, including, I'll list out a few here, prominent hospital operators like the University of Chicago Medical Center and Rush University Medical Center in Illinois. Medical technology leaders such as Medtronic, Boston Scientific, and Johnson & Johnson, smaller community hospitals and rural health clinics are struggling to stay afloat. Health insurers looking to boost profit margins across the US. And we see this even in healthcare adjacencies like medical billing and healthcare IT have not been spared. The cuts that I see run wide and deep across the sector. For patients, these layoffs represent a crisis in access to care. Emergency room wait times continue to rise while nurse-to-patient ratios deteriorate. Preventive and elective procedures will face new delays. But for the healthcare executives and shareholders, the cuts have boosted profits and share prices. As Moody's chief economist candidly stated, quote unquote, "This is the way the American capitalistic system works. It's ruthless when it gets down to striving for profitability and creating wealth. It redirects resources very rapidly from one place to another." Many hospital operators cite declining revenues and admissions that are also declining as a justification for cuts. But system-wide layoffs disregard the ongoing public health crisis and the underlying patient need. In reality, most major healthcare providers remain profitable. Smaller community hospitals face closures or acquisition concerns, while large systems consolidate power. In the meanwhile, patients suffer the consequences through exponential rising of costs and eroding access to care. Nurses, technicians, and other frontline healthcare staff have been continually stretched to the breaking point by poor working conditions and stagnant wages. Now, this is according to the Bureau of Labor Statistics. Healthcare workers led strikes across the country in 2022. However, the union bureaucracy has matter-of-fact worked against the rank and file, containing strike actions and imposing concessions. As healthcare corporations attack jobs, the physical and mental well-being of caregivers and the communities that they care for continue to suffer. Patients lose access to high-quality care, accelerating negative health outcomes. Executives and shareholders continue to enrich themselves and their bottom lines as the system that we know breaks down. The search for profits, not for patients, is the theme behind these layoffs. The reason for these layoffs is a system structurally dependent on delivering shareholder returns over patient care. As Moody's projections show, years of private equity mergers and acquisitions have left hospitals dangerously overleveraged. Many of them are reported to be defaulting on debts as their operating costs soar. At the same time, payers continue to constrain reimbursements. Insurance companies and government health programs exert downward pressure on margins to control their own costs. Caught in the middle, Healthcare providers are resorting to cutting caregivers as the quickest and the easiest path to expense reduction. Contrast this with the vast waste and inefficiency that we see inherent in America's multi-payer insurance system. Now you combine that with soaring drug costs, which are uncontrolled, and expensive medical device costs, the US healthcare system costs substantially more per capita compared to other high-income countries or developed countries. Yet, health outcomes lag and medical debt continues to financially devastate families. This pattern of mass layoffs also epitomizes the pursuit of profit over meeting patient needs. The system routinely tosses caregivers aside while executive pay and investor returns break new records. This remains an acute failure to align health and social priorities with healthcare delivery and healthcare business. Rather than a piecemeal approach to cost reduction, the healthcare system requires systematic change from the ground up. As long as patient care remains subjugated to shareholder primacy, access and quality of care will continue to suffer. To truly address this crisis, healthcare must be radically restructured to serve the public and their outcomes, not private wealth building. Hospitals and health systems should be brought under some sort of a public ownership and control. Compensation should prioritize frontline caregivers, overall patient care, patient well-being over executive compensation and profit making. With patient well-being the guiding decision-making factor and not stock prices, high-quality services can expand to fill community needs. I feel healthcare is a human right, and as corporations attack that right, caregivers and communities must reclaim it. What should we do? I feel we must challenge the notion that layoffs represent an unfortunate but necessary byproduct of financial realities. In truth, mass terminations showcase the need to radically reorient the healthcare system around patients and not around profits only. Elected leaders have demonstrated an unwillingness to intervene against corporate power in healthcare delivery. Washington insiders and their power corridors remain filled with healthcare lobbyists working against systemic reform. Nor can backroom union negotiations secure change when officials actively restrain worker militancy. Labor peace pacts and concessions cannot challenge capitalistic ownership of healthcare institutions. Instead, we need a campaign of mass action targeting shareholder meetings, company headquarters, and figures of authority across healthcare system need to be educated on this. Health workers and allied community activists must take the lead in educating the leadership of these companies and our elected leaders. The healthcare justice movement can be started that can articulate demands for perhaps a universal single-payer healthcare coverage system or expanded public healthcare delivery, prescription drug pricing reform, and maybe healthcare nationalization. Hospital occupations should demonstrate worker and community control over healthcare decision-making instead of insurance companies to prevent closures and layoffs. As during past periods of labor unrest, direct action and demonstration can shift public opinion towards transformative change. The wave of layoffs in the US healthcare industry, in fact, reveals a system in deep crisis. Patient health continues to be compromised, while, as we spoke earlier, corporate budgets and share prices thrive. To chart a new path forward, communities must continue to rally around a vision of healthcare centered on caring, quality of care, quality of outcomes, and not profits only. Systemic issues demand systemic solutions. The struggle for healthcare justice has to happen, but so must our solidarity if we wish to overcome by taking direct action, writing to our representatives. By doing so, we can build a mass movement necessary to transform the minds as far as healthcare is concerned as a public good for all. I feel the time is now for activism over business as usual, and the fight should continue onward. If you like this video, please consider subscribing. And don't forget to like, share, and subscribe. Also, check out my other videos on my channel. Your support fuels our commitment to bringing you the most compelling and cutting-edge stories from the intersection of technology, healthcare, and humanity. Until the next time, folks, be well, and I will see you in the next video.